that they've got no output, in other words, that they've gone into cardiac arrest, we need to be asking, is there an AED, please? If there is, can someone fetch it for me? So that's why it's absolutely important that everybody knows where the AED is, and I would say even players as well. Everybody needs to know where it is and how to access it, okay? Now yours is in a yellow cabinet. Does anybody know how to get access to it at all?
Yeah, I'll be the code.
Okay, yeah, so you've got the code. What if you're out somewhere else and you ain't got the code? What this chap said here is, you ring 999 or 112.
They'll tell me.
And they will tell you the code. You will then access the box and take the AED out. If you don't feel confident to use it, ambulance will stay on the phone with you and guide you through it. But these things are pretty damn well foolproof. They are designed for the general public to pick up without any real training at all and to use. They will speak to you and tell you exactly what to do. People often say to me, well, what if it shocks them and they didn't need it? There's not a chance of that happening. It's so clever, it can detect the rhythms that will need shocking. And it will only shock them if it requires, it will tell you to shock them if it's required. So it won't make a mistake, okay? They're very, very safe piece of kit. So, this arrives, say Darren brings it over to me, he says here it is, we've got an AED here. Okay, what do you want me to do with it? So I'll pass it in the air for a minute. Okay, we open it up, the one you've got is very simple. I think the minute you open yours, it activates and he starts talking to you, okay? And it will usually say something, I'll put this one on. Don't worry about all these because I say this is a training one. Yours has only got, I think, probably one button on it, okay? One in the middle probably, the one that will tell you to push to defib somebody. And we are getting one like that one to train. This one was not ideal. But the principles remain the same. So we're going to put them on, the pads. We'll have some protectors on. We'll take them off. I'm not going to take them both off for now. And it tells you where to put them. So one goes here, okay? And this one's even got an arrow to tell you where to do cardiac massage on, all right? Some of them come with left and right on them. If you did get them mixed up and put right where left is and vice versa, don't think, whoops, I made a mistake, I need to rip them off and start again. You don't, okay? It will still do the same job. Right. So, before I...
quick question.
Yeah.
Say someone's got a really hairy chest.
Coming on to it now, that's what we're going to do. Yeah, no, it's going to do that next, okay? Yeah, so, what Dave was brought up over there is what we're going to talk about next. Some do's and don'ts and little tips that we get. Most AEDs will come with a pair of scissors and a razor. Any idea why? Yeah, thanks, yeah. Thunder there. Yeah, because some blokes are really airy grillers. I can vouch for that, having looked after them. And the worst thing you're trying to do is you're trying to put these on and they're floating on their airy chest, okay? Which is absolutely no good at all, because the minute you shock them, that shock tends to disperse out and they don't get the full jolt that they should need. So get your razor out, okay? Shave the air off, yeah, okay? Fairly quickly, you know, don't need to do a neat job about it or anything like that. Just whip it off where the pads are, like that, off it goes, all right? Scissors off for cutting off the shirt or clothing, because you're going to need to get directly to the chest, aren't you? Okay. Cardiac arrest, if you can't, you need to rip the shirt off, bra, lift it up, get rid of it, okay? There's no dignity in cardiac arrest. You're trying to save the life, okay? That's the main aim of it. Yeah, so want to shave the chest, put the pads on there, yeah. What about any other precautions?
Jewellery.
Jewellery, thank you very much, yeah. Okay, jewellery. If you've got a medallion, don't think we wear them these days, do we guys? Medallion, man's like in the 70s. But if you've got a medallion trapped under there, nipple piercings, of course, now, for men and particularly, I think they have them now, don't they? Women, I suppose they do as well, yeah. Okay, if you've got time, take them out, yeah. Put the medallion or jewellery to the side, yeah. And then put your pads on, because all that can cause some burns. At the end of the day, if you can't get them out of here, don't worry about it. It's better to have some burnt nipples and save their life than worry about trying to get them out, okay? All right, yeah. Good, so shave the chest, remove the jewellery and things. If this patient has collapsed and they're in water, I don't mean in the water, but they're lining a pool of water and their chest is soaking wet with water, Anybody know what we're going to have to do? Yeah, I know it's common sense, but yes, we're going to have to dry it, aren't we? Because electricity and water are not very conducive together, are they? Okay, so might have to use your best hoodie or whatever, whip it off, or your coat, dry it off. Okay, yeah. Put your pads on. If they're in some water around them, as long as you're not in direct contact with them, you are safe. Okay, because when you're defibbing somebody, that's what we mean when we're shocking them, defibbing them. Okay, you will not be touching the patient at all for obvious reasons. You're touching them, you shock them, whoomph, it goes through you as well. I've seen some near misses in hospital. We have to follow really strict protocols there, okay? It will tell you though, do not touch patient, stand clear, okay? It will give you precise instructions on that, yeah? Good. Right, so as I say, they're pretty foolproof. It will not shock them inadvertently. It will analyse the rhythm, I think, every 30 seconds to a minute, every 2 minutes, sorry. So in between that, it will tell you to either A, continue doing chest compressions, or it will advise a shock. Yep, if you've done the shock and it stays in that fast rhythm, it will just say to you, continue CPR for 2 minutes, and it will tell you, analyse it again, and it will tell you if you want to shock it, or just to carry on doing chest compressions again, okay? Good. Right. So, again, I'll just give you an example of what it does sound like a little bit, okay? Come on in a minute, just come on. Speak. It will speak in a minute.
Unit okay.
This just gives you an
Stay
idea.
calm. Check responsiveness. Call for help. Open airway.
Yep. That's just giving you time to check.
Check breathing.
As I said, this is a training one, so the one you've got won't tell you to do all that, but this it's just
Attach defib pads to patient's bare chest.
we've done, yeah. And then when you get to this stage, as I say, we'll tell you what to do.
Attach defib pads to patient's bare chest.
It will say analysing. It will detect if it's in a very fast heart rate. If it is, it will probably say
Attach
shock
defib pads
advised.
to patient's bare chest.
Yeah.
Unit okay.
Yeah, so we'll advise you all along, okay? Just do what it tells you to do. Yeah? Just, it's as simple as that. Yeah? Any questions on that one at all? No? I know sometimes it sounds a bit scary that we're going to put a shock of electric through them, but remember, they're dead anyway, so the best thing is you're going to save their life, yeah? As I say, just do as it tells you to do, and they're foolproof. Yeah? Alright, any questions on that one at all? Happy about accessing the box, the code, ringing ambulance to get it, etc. Yep, everybody knowing where it is. Okay. Any questions at all? Okay. Right. Anything else you want me to cover at all?